this is Dr. Kahl Goldfarb with Water and Sports Physical Therapy. We're here today at our downtown clinic with our patient Will, and we're looking at proprioception, the ability for a person to stand and control movement in space without using their eyes, which normally overcompensate with. In order to do that, we're going to try to figure out whether the problem is coming from his foot and ankle, his knee, his hip, or his spine. So the way we do that is we're going to stand in one place. We're going to stand on his involved leg, which is the right side. We'll go to a 90-degree angle, and we'll have him eyes open, test that stability. We'll test him there and see how well he's able to hold if he's having a compensatory swinging pattern. And we'll do knee locked. So with a knee locked, we're taking the proprioceptive input from the knee out. We're using the ankle, hip, and lumbar spine to check how those neurological impulses up and down in the brain are working. If he's good there, we'll try unlocking the knee. If this is more difficult, we'll find out if he has issues more in the knee. So we're taking the knee out, the knee back into it. We can't rule out anything else, but we just know knee is more or less of a problem. If it's easy for him, which he's doing a great job, we go eyes closed. So you can see his balance is pretty good there. Eyes open, and we just tested him earlier. Eyes closed is good as well. The next test we're going to do is get him kneeling. Now, when we have him kneeling, we're now taking out the foot and taking out the knee from the proprioceptive input to the brain. We're going to line him up in a straight line so he's able to put his weight through his hip and lumbar spine. This is where all of the input is being received. If he's in a straight line, don't let him lean forward, because then he's putting more stretch and pull on the anterior capsule and the muscles to give him more stability. We want him straight up and down. Make sure his foot in the back, he's not putting too much pressure on, and the foot in the front, he's not moving too much. In this position, if he does eyes open with the foot right in front of him, you can see he's going to want to move back and forth. His foot's moving up and down. That right there shows us it's a little more difficult. If we go eyes closed, this is definitely harder for him than we had eyes closed standing. He was able to stand eyes closed for at least 15 seconds without any sway. With this, he has more of a sway and definitely more compensatory patterns in the front. So you can open up. So basically what we're looking at is for Will, he has more of an issue in the hip or lumbar spine than he does in the ankle, definitely, and more than he does in the knee. So we would treat him appropriately to make sure that the ability of the hip and lumbar spine can send messages to the brain quickly, send messages back to the muscles to kick in right away. For athletes, this is of extreme importance, because if they don't have that quick impulse, they're going to be delayed. And when you're delayed, studies show that's how we have injuries and re-injuries. If you have any questions, feel free to view us at waterandsportspt.com.